The types of therapy that you think might help, are there?
Definitely cognitive behavioral therapy by retraining their responses, their reactions. They tend, children with ADD and ADHD tend to act before they think. It's more impulsive. They get a thought and they act on it immediately without filtering if it's appropriate or not. Slowing them down, letting them think about consequences. Cognitive behavioral therapy is a great way to retrain their habitual response to impulses, like, take a breath, count, whatever, but it does help. And together with medication, I've seen tremendous improvement. However, since COVID here in the US, we've had a huge shortage of therapists because they're so busy treating other problems that it's hard to get a child in for that. We end up relying more on the medication and just helping the parents do the best they can with the child at home. They have a lot to look forward to, and we're going to help them with the math or the reading that they're struggling with.
The question from me, in terms of how much testing do you do regarding, gut microbiome? Do you do stool tests, and would you run organic acid tests on these children, or
exactly
hair mineral analysis?
Yes. If it were up to me, I'd do all the above right at the beginning, but most families that I see don't have a budget for all these tests. We start with tests that maybe the insurance company will cover and pay for. And if they have a budget to do one of these functional tests, then we embark on that arena, because it does give me a lot of very specific information that I can dial my therapies towards. So yeah, those are excellent. The hair mineral, the food sensitivity test, the stool test, check the microbiome, and also to make sure they're absorbing the fats and that they don't have yeast or other parasites. And the organic acid test gives me a ton of information on the neurochemicals. I really need that info. If I'm going to create a program with supplements instead of using medication, I need those tests. But if they're going to be on medicine and we're just trying to optimize their physiology, then maybe the insurance covered test is enough.
How common is ADHD? Can it be misdiagnosed? What are the most common symptoms for kids?
In the US, because that's all the statistics I know, they say that 1 out of 16 children has it. That's quite common. So in a classroom of 30 kids, there might be 2 kids in that class that have it. The way it's diagnosed is by using questionnaires. We don't have a standard test to make the diagnosis. What I use the test for is to try to figure out the underlying function of the body for that particular child and what that particular child needs. But the diagnosis is made by getting histories. I use specialized form called the Connor forms. Other doctors use the Vanderbilt questionnaires. We have different questionnaires we use. And based on that, the doctor can say, yes, we meet the criteria, or no, we don't. Getting a good history is very important. And I think the physical exam is somewhat revealing, not much, because sometimes I'll have kids that all the questionnaires are like very high scores, and yet they're sitting quietly and doing beautifully in the room with me. There's sometimes a discrepancy in their behavior in the exam room versus how they behave in a school classroom or at home. And that's why it's important to look at all these areas when we're trying to make a diagnosis. And then remind me the third part of that question.
I was just going to touch on when you were talking about the testing, actually just go back to that earlier question, sort of in regard to this a little bit as well. Do you find that the testing helps the parents understand and the caregivers understand better about the nutritional needs and the environmental needs for the children? Is that a really good use of the testing?
Yes, because like when you take a diet history, especially in a medical office, I'm not a nutritionist, so I'm not going to delve into, every meal and break it down and go into a lot of detail. I'm just trying to get an overarching menu for the school week. Like, what do you tend to eat during the week? And most parents will say, well, they eat vegetables, they eat meats, they eat this, they eat that. Okay. So I don't hear that there's necessarily a gap in their nutrition by doing that kind of a survey. But when we test, we see, well, look, their vitamin D is low. Are they not drinking enough milk? Their iron is low. Are they not eating enough protein? So then we start seeing those deficiencies for that particular child. Like there's gaps in your diet that I couldn't get from history alone, and only the testing reveals that to me.
What should we ask our doctor about our child's ADHD, and how should we prepare for our first visit?
If you're going to get the diagnosis, like you haven't been diagnosed yet, but you want to evaluate. Yeah. I think asking the doctor what their feelings and thoughts are about a holistic approach. Once the diagnosis is made, you can go even a step before, like what processes, what methods do you utilize to make the diagnosis? And if we have that diagnosis, can we look at more holistic approach, or are we relegated to just medication and that's it? Because I think most traditional pediatricians, that's all they know. That's the only tool in their toolbox. They have not studied nutrition and functional medicine. So they don't know about these other modalities. It's not their fault. If you go to a cobbler, they have their tools too, and they're not going to use a different set of tools, right? So each profession has their sort of training and brainwashing. I'm going to use that term because that's what happens in those 10 years in med school and residency. They come out knowing, okay, these are my tools, this is my toolbox, and they don't know anything outside of that. If you're a parent that's more holistic minded, you may want to research, like, are there integrative doctors in my area that I can go see? Because they're going to have the more general scope and be more open to entertaining, even if they don't know, if they're at least open-minded, they'll be allowing of you to go see a naturopath, to go see a chiropractor, to go see other types of healers that can combined together provide the best solution for your child.
You mentioned earlier about cognitive behavior therapy. Do you think that that kind of therapy plays an important role for these children, or, psychology, seeing a psychologist?
Yes, it does. Not alone. It's not a solo therapy to do cognitive behavioral therapy, but when it's combined with medication or other interventions, it is definitely additive. And we see that there's significant improvement in their ADHD scores for children who do combined modes of therapy. So not just psychological, but combine it with some other biological therapy.
So with the nutrition, the environment.
Yes.
Yeah. Excellent. We don't want to medicate our child. Can we just use supplements, or is medication the best thing I can do and I just need to accept that as a parent?
You don't need to accept that. I think looking at nutrition is number one step, to be honest, because if the child's not getting enough protein or omega-3 or whatever mineral vitamin they're deficient in, then that's where we need to start. Next step would be supplements, because now we're giving specific doses of, let's say, tyrosine or tryptophan or vitamin C or whatever we feel is needed based on testing. We would be testing the child, and based on the test, we would recommend these supplements.
And I just wanted to go to the question from the parents needing more support. Does some sort of therapy or cognitive behavior therapy, is that helpful for parents? Like, is it helpful for them to learn skills for themselves with coping and to be what?
I don't know if it's cognitive therapy or family therapy. Family therapy for the parents.
Yeah.
Because they're learning parenting skills through that, but cognitive behavioral for the children.
Right.
And it starts at 5 and up. I don't think a child younger than 5 can sit through a session. So 5 and up is when we would start.
What do you think about, stigma attached to a diagnosis and, it's one of those children? Is that, I can imagine that must be very stressful for parents and families.
What we have to remember is these children are still divinely created, just like we all are, and they have their place in the universe. We just have to nurture them and grow them in as a loving way and accepting way as possible, so they can thrive and do the best they can as they become adults.
How often should my child's medication be reviewed by my doctor?
If you notice that it's slipping, it's not working as well, you should go and have redo the questionnaires from the teachers and you yourself, and then have the doctor review with you what's happening. Some children, as they go through growth spurt, need adjustments, I would say every 3 months. Some kids can go 6 months, a year, and not need an adjustment. It's very individual. And I would say the parents should watch for any lack of effectiveness. If it was working and it stops working after a while, it's probably time to revamp and up the dose.
And what about the role of glutamate? Is that something that you see or that should be looked at?
It can show up on the organic acid test. When we look at the neurochemical part of the organic acid test, it can tell me if their quinolinate and kynurenate is elevated, which is a reflection of the glutamate. And in that case, we would want to do stuff to reduce inflammation. Those are inflammatory markers. And if we see them, it means the brain is on fire and we've got to put the fire out.
Should I need a second opinion or trust a diagnosis from my doctor?
A conventional doctor is going to work in the conventional method. If you want to see what holistic medicine can offer, I would get a second opinion.
And we've just done our hour, I think.